Dr. Pramod Reddy Kandapure. I am Chief Cardiothoracic and Aortic Surgeon and Minimally Invasive Surgeon in Medicover Hospital, High Tech City, Hyderabad. Today I am going to talk about minimally invasive cardiac surgery. There are evolving trends in cardiac surgery. Previously, we used to do big incisions. We used to cut the bone. The standard operation was to cut the breastbone and do surgery. But we have moved from cutting the breastbone to minimally invasive small incisions, which causes less pain and early healing, early post-operative recovery, and getting back to work early. These are the advantages of minimally invasive cardiac surgery. So what we do in minimally invasive cardiac surgery, instead of cutting the bone in the center, we go through in between the ribs. We put a camera sometimes and we cut, and the incision is around 5 to 7 centimeter. So depending upon what surgery we do, it will be sometimes right side surgery or sometimes left side surgery. So what surgeries are covered under minimal, or what surgeries we can do in minimally invasive cardiac surgery? The first surgery, the commonest surgery, is coronary artery bypass surgery, or what is commonly called as the bypass surgery. So we do it from the left side, just below the nipple we cut it, like 5 to 7 centimeter we cut it, and we have some instruments, special equipments are there, so we can do surgery from that place. So roughly single vessel can be easily done, but now we are very comfortable doing multi-vessel grafting, like 3 grafts, 4 grafts also can be done from the left side. Having said that, CABG surgery can be done from the left side. It is not for all patients. Patients has to have a good LV function, a good heart function. The arteries, the distal arteries where we want to anastomose the vessels should be in good size, and the patient should be thin, not very obese, and patients should not have kidney problems or lung problems. These patients we have to select, and depending upon that we can do surgery. Those patients who are not suitable, we don't have a choice, we have to still do standard operations. The other surgery which is done is valve surgeries. Valve surgeries like mitral valve surgery and aortic valve surgery can be done from the right side. So depending upon which valve we are doing, we choose a different space. So mitral valve surgery, we go from the 5th intercostal space, and for aortic valve surgery, we go from the 2nd or 3rd intercostal space, depending upon where we see the aorta. So mitral valve surgery, we do it from the 5th intercostal space. Especially in the females, it is very good because we go below the breast and then the scar is not seen. And in some patients who are very thin and thin chest wall, we can in fact do from the right axillary incision. So the scar is not seen in those young males patients also. And then the valve repairs, valve replacements, both surgeries can be done from the same incision, same approach. The other surgery which is done is aortic valve surgery, or also the tricuspid valve surgery. For the aortic valve surgery, there are 2 approaches. One from the anterior approach and one from the lateral approach. The anterior approach, we go from the 2nd or 3rd intercostal space on the right side, and also the transaxillary approach also is possible depending upon the patient's weight and the body stature. So in this case, the aorta, we have to do some investigations before considering for surgery, like the CT we have to do, CT aortogram we call it, or CT chest we have to do it, and then we have to see where the aorta is lying, how far it is lying on the right side. Depending upon that, we can do from the anterior thoracotomy or axillary approach. Axillary approach, if we do, the scar is not seen. Anterior approach, here the scar is seen, like roughly around 5 to 7 centimeter scar is seen. The third commonest surgery can be done from the minimally invasive approach is congenital heart surgery. In congenital heart surgery, ASTs, VSDs, partial AV canals, pink tetralogy, these surgeries can be done through minimally invasive approach. So the approach is same as mitral valve surgery, like 5th intercostal space, inframammary line, or transaxillary incision, depending upon the patient stature, especially in female patients or those young girls. We do it from the transaxillary approach because the breast development is not there. Breast development does not hamper in the future. Also, the transaxillary approach is better cosmetically compared to the inframammary approach. The other surgeries which can be done are tumor surgeries like atrial myxoma, and for the aorta, some tumors are there which are attached to the aortic valve. Those surgeries also can be possible from the minimally invasive surgeries. The 5th surgery which can be done is aortic aneurysm surgery. This is like recent advances, we have done it. Aortic aneurysm surgery. It can be done from the hemisternotomy. Instead of cutting the full sternum or full breastbone, we cut only the part of the breastbone. The upper part of the breastbone is only cut. And we do the surgery as we do it normally. The approach is good and then the results are same. The advantage is that we are not cutting the breastbone completely, so the breastbone is intact. So the patient can lift weight after 15 days or 1 month. So if he's a laborer or if he does a heavy job, he can do it. Plus, the chances of wound infection or delayed healing is less if you try to preserve partial or full sternum in these cases. So what advantages are there? In short, I can brief you that minimally invasive cardiac surgery is the future of cardiac surgery. As in any other specialties, we are also going into the minimally invasive cardiac surgery, small incisions, early recovery, better cosmetic results, especially in young girls. Less blood products is used because less bleeding is there, less chances of wound infection, and patient can do his normal activity or get back to his work as early as possible. Most of the patients, they go early, like 15 days to 3 weeks time, they can go back to their normal work. Plus, the hospital stay is less, the hospital ICU stay and hospital stay is less. So these are the advantages of having a minimally invasive cardiac surgery. And to summarize, what surgeries can be done commonly is coronary artery bypass surgery, valve surgeries can be done, congenital heart surgeries can be done, tumor surgeries can be done, and aortic surgery or aortic aneurysm surgeries can be done through this approach. We have moved, in some cases we have even done with the endoscopic approach, is putting an endoscope inside, and in the future, very soon, we are going to do a robotic heart surgery with the same approach using a robot. So these are the future advances will be happening in minimally invasive cardiac surgery.